Hi, my name is McKenna Koima, and I was in a group with Abby Vetch and Karina Timmermans, and I'm going to be talking a little bit more about cystic fibrosis. So what is cystic fibrosis? So cystic fibrosis is a hereditary disease, which means that your relative more than likely inherited this, and it affects the lungs and the digestive system. So right now it's causing your relative to produce thick and sticky mucus or secretions, which normally your body would produce more like thin and slippery mucus. So with CF, your relative, it will produce mucus that's difficult to cough up out of the lungs, which can make breathing very difficult for your relative and lead to severe lung infections. So with assessment, we're first going to look at, So complications that can come with CF can be life-threatening, and respiratory complications can include the collapse of your airways and the collapse of your lungs, and it can even cause your relative to have pneumonia. And then there are complications with your stomach's GI, so that's your relative's stomach and intestines, and that includes dehydration or malnutrition because your relative is going to struggle absorbing the fats, proteins, and even vitamins that they need to correctly. So the thick and sticky mucus associated with cystic fibrosis clogs your relative's tubes that carry air in and out of their lungs. So symptoms of CF can include a persistent cough that produces mucus, wheezing, exercise intolerance, or repeated lung infections. And then the thick mucus can also block tubes that carry digestive enzymes from their pancreas to their small intestine. So without these digestive enzymes, your relative's intestines aren't able to completely absorb the nutrients in the food they eat, and that results in foul-smelling, greasy stools, poor weight gain or growth, intestinal blockage, and severe constipation. So for assessment, we will assess your relative by first looking at the history. And weirdly enough, it's been known that parents will report a distinct characteristic of the taste of salt on their child's skin when they kiss them. And so we may ask you if you've experienced this with your relative, and we will also ask about any repeated respiratory infections like croup or pneumonia that may have been prevalent in your relative's first or second year of life. And then lastly, we will look at your relative's achievements of developmental milestones, because that also just gives us a place of where they're at in development. And then we will also do a physical exam, which will just be us listening to their lung sounds and seeing if there's any wheezing present, and then also just looking if they've had a chronic cough or a production of mucus. And then we will also do a psychosocial exam, just because your relative will not be able to compete in any high-level activities or sports, and they will have a short stature and small body structure, so this may result in them to have a lack of self-confidence or a low self-esteem. So we will make sure to do everything we can to make sure that they know that they have control over their life, and also just encourage them to embrace who they are. So the cause of CF, so because it's inherited, that means that your relative would have had to inherited the defective gene from both of their parents. And this defective gene is what changes the protein that regulates the movement of salt in and out of the cells. So this would be the reason why your relative would produce thick or sticky mucus in the respiratory, digestive, and reproductive systems, as well as increased salt and sweat. So to diagnose CF, so because all newborns in the U.S. are screened for CF, it's likely that your relative has already been tested, but we do this through small blood samples, and this would help indicate that your relative might have a health condition and require further investigation. And then to evaluate if an infant or your relative has cystic fibrosis, we would usually conduct a sweat test once they are at least 2 weeks old. And this is just when we apply a sweat-producing chemical on their skin, like a small area of their skin, and then we'll collect that sweat to test it and see if it's saltier than normal. And then if the sweat test comes back and there are unclear results, then we'll usually do genetic tests that can be used by analyzing the cheek cells or a blood sample. And these tests are mainly used just to find out if your relative carries the CF gene, and then just confirm the CF diagnosis. And then for treatment, so I'm sorry to inform you there's no cure for cystic fibrosis, but treatment can ease the symptoms, reduce complications, and improve your relative's quality of life. So first, we would look at medications. So there are medications like antibiotics to treat and prevent lung infections, and there's also anti-inflammatory medications to lessen swelling in the airways of your relative's lungs. And then there are mucus thinning drugs to help your relative cough up the mucus easier, and then that can improve lung function as well. There are also airway clearance techniques that can be used to help with mucus obstruction and help reduce the infection and inflammation in the airways. And these techniques just loosen the thick mucus in the lungs and make it easier for your relative to cough it up. So these can be things as simple as just a technique by using cupped hands on the front and back of your relative. And then there are breathing and coughing techniques that may be used as well. And then there's also mechanical devices that can help loosen lung mucus, like a tube that you blow into, and then a machine that pulses air into the lungs, such as a vibrating vest. And then there's also exercises that you can do as well. We want you to know that we will work with you to determine what treatment is best for your relative, and then find the best chest physical therapy that's best for them as well. So following up with your relative, we will just make sure they are paying attention to nutrition and fluid intake, keeping their vaccinations up to date, exercising, washing their hands, and attending medical appointments. And we will also have to remind you that your relative cannot be around another person with CF because of their dangerous bacteria in their lungs that are only contagious to CF individuals or individuals with immune disorders. But we do want to inform you that the good news is that CF is not contagious to healthy people. And then an individual with cystic fibrosis born in the United States today is expected to survive longer than 40 years. So the median survival age is higher in males than in females, and with current treatment strategies, 80% of patients should reach adulthood. So because of advancements in treatment and new treatment methods, the outlook for your relative is very promising. So these are my sources. That's all I have for you guys today. If you have any questions, feel free to ask. Otherwise, you can use these sources as well to find some more information.